In this video segment, that of a 45 years old female with a history of constant pain in the pelvic region. What we see here is, in this image in front of you, that this is the anterior myometrium, this is the uterus in longitudinal section measuring 6 by 2.6 centimeters, and patient says that she is not menstruating, is in menopausal phase. This is a small solid hypoechoic area measuring 9.1 millimeters, and this is the same one with echogenic area within it, and in the center of it with no shadowing. And these two regions are the same in different angles, in different scanning planes, and these are consistent with fibroid of the uterus. Now this is the left ovary, this one, and you can see developing follicles in you can see follicles in different stages of development. Now there is free fluid seen in the pelvic cavity. This is the free fluid that is seen in the pelvic cavity in this particular image. This is what you are seeing. This is the left ovary with follicular activity. This is the follicle, and this is the free fluid. This is the subserosal posterior wall hypoechoic fibroid, solid region that is a fibroid. This is the longitudinal section of the uterus. And as I move the probe towards the left adnexa, where menopausal uterus, fine, no problem, uterus is okay, has started developing fine calcification, tiny calcifications in the upper edge of the myometrium. So this is the normal uterus, otherwise with a small fibroid, some serosal fibroid. And now as I move the probe towards the left adnexa, towards the right adnexa, you can see free fluid. This is the free fluid. These are the bowel segments. And not only that, in transverse section, there comes a solid echogenic area in view. With iliac vessels coursing posterior to it. These are the iliac vessels, internal iliac vessels, and this is the solid echogenic mass. With fluid around. This is the mass, measuring 3.9 or say 4 by 4 centimeters. This is the mass. With fluid in the peritoneal cavity as well as in the dependent region, peritoneal cavity as well as in the pelvis. This is the mass. This is the urinary bladder. This is the fluid. This one free fluid. This is the urinary bladder in longitudinal section. this area, and these are the bubbles here. This is the echogenic mass with tiny internal cystic areas within it. This one, this one, this one, all of this. Okay. So, keeping in view the age of the patient, this pathology appears to be of aggressive nature, also keeping in view the fact that there is ascites and the area is solid because you do not see any significant posterior wall enhancement behind it. This is the solid area, and you don't see any posterior wall enhancement or strong back wall. It is rounded, it does not change its shape while change in the angle of the probe. And thus this is so this is a case of today, which with concluding remarks that this is a case of menopausal uterus with subserosal fibroid and fluid in the pelvic as well as the peritoneal cavity, along with here you see fluid in the pelvic cavity, and sorry, this is the fluid in the dependent region, peritoneal cavity, yeah, this one, and here you will see fluid posterior to the uterus and has echoes also. This is the fluid of the ovary and a solid mass in the region of the right adnexa with tiny cystic areas within it. No calcification is seen within the mass, and thus this is our case of the day. Thank you very much.